Okay, so the side lunge or lateral lunge. Only a few cues that we're looking for. So you're going to go ahead and take a wider stance than normal for your squats. Definitely play around with your stance, and we'll go from there. So first things first, we want our feet pretty much straight forward. If you gotta like turn them out of hair, that's fine too, but basically straightforward is what we're looking for. And what you're gonna do is you're gonna keep a slight brace. We're gonna start without a weight or anything in our hands. I would recommend doing this in front of a rack or a machine or just something that if you lose balance, you can just grab onto it, or if you start to fatigue and you can't get up out of the hole, you can pull yourself right out. I know that I needed to use the rack for the first couple weeks of doing these, so beginners might just need a little bit of help, and that's fine. So what you're gonna do, your slight brace, you're gonna get most of your weight on your heels. During the squat, we like to have our weight equally distributed between the 3 points of the feet, but for this, just on the heels because the weight is gonna naturally transfer forward. What you're gonna do is lunging to one side, you're gonna sit back, sit back, sit back, sit back. You might have to put your hands out in front of you so you can get the balance down. Go as low as you can, kind of hold it. You're gonna feel it in your glutes and your quads. You're gonna push up to the middle, and you're gonna go down to the other side. Sit back, sit back, sit back, sit back, sit back, sit back. You might hear this really bad cue that you don't want the knee to go past the toes. That's made up. Anyone who says that is not worth listening to. However, because we are sitting back, that's probably not going to happen. But if it does, totally okay. I know some people have knee injuries. I might got some Osgood's, little tendinopathy in there, or if you have meniscal issues, something else going on the knee. Play around, figure out what works best for you. We're looking for minimal pain on this. So from the side, what that's going to look like, again, taking your stance, feet forward, you're going to kind of brace, butt back, hands out where they got to be, kind of sit back, sit back, sit back, sit back, sit back, bam, and up, sit back, 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 and up. So as you go, you are going to feel in your quads, you're going to feel in your glute max, but what I really want you to focus on, most importantly, is going to be adductors and glute medians, or side butt, some people call it. So basically, as you go down to one side, let me get in the video a little better, as you're going down to one side, right, you're going to really feel it on this glute med. You're also going to feel a nice stretch in this adductor. So while you're going from one side back to the middle, I want you to think about using this side butt to push yourself away and using this adductor to pull yourself towards the middle. So it's going to be a push and a pull. So what that allows us to do is push and pull to the middle. Flip sides, going down, push and pull towards the middle. You're going to feel a little bit of pulling in the anterior groin. That's totally fine. If that gets a little too intense for you, starts to cramp up or whatever, no big deal. Just narrow your stance. Generally, all that is one of two things. Maybe you do have to kind of toes out a little, or just got to bring your stance in because those tissues start to, basically they have to adapt, so they get less tight over time. Okay, let me know if you have any questions.